When people think of global power, they often picture military strength, tanks, missiles, aircraft carriers, and nuclear weapons. But one small Caribbean nation built influence through a very different strategy: doctors. For decades, Cuba has used healthcare and medical training as a major tool of diplomacy. While facing a long-running U.S. embargo and recurring economic hardship, Cuba invested heavily in public health, education, and overseas medical missions. The result has been one of the most unusual soft power models in modern geopolitics. After the 1959 revolution led by Fidel Castro, many Cuban doctors emigrated, creating serious shortages. In response, the government expanded free medical education, increased the number of training institutions, and built a nationwide healthcare system focused on prevention and local access. By the 1980s, Cuba had introduced a neighborhood-based family doctor model. Small community clinics placed doctors and nurses close to where people lived, emphasizing routine checkups, vaccinations, maternal care, and early treatment. But Cuba's healthcare system became internationally known through overseas missions. Beginning in the 1960s and expanding significantly after the Cold War, Cuban medical brigades were sent to countries in Latin America, Africa, Asia, and the Caribbean. They often worked in rural areas, disaster zones, or regions with severe doctor shortages. According to Cuban and international estimates, hundreds of thousands of Cuban medical professionals have served abroad over the decades. During the 2014 Ebola outbreak in West Africa, Cuban teams were praised by international officials for rapidly deploying trained personnel to high-risk areas. One of Cuba's most significant partnerships was with Venezuela. Under agreements in the 2000s, Cuba sent doctors and technical staff while receiving subsidized oil and financial support. Similar programs later expanded to countries including Brazil and several African states. Medical exports became a major source of foreign currency for Cuba, at times exceeding tourism revenues according to independent analysts. Cuba also invested in biotechnology, producing vaccines and treatments that were exported internationally. Another pillar of Cuban influence is the Latin American School of Medicine in Havana, which has trained thousands of students from low-income communities around the world, often at low or no tuition cost. However, Cuba's medical diplomacy has also faced criticism. Some host countries, rights groups, and defected doctors have alleged restrictions on movement, low personal compensation, and state control over earnings. Cuban authorities reject many of these accusations and describe the missions as voluntary solidarity programs that save lives. Today, Cuba's domestic healthcare system faces serious pressure from shortages of medicine, equipment, fuel, and staff migration. Yet despite those challenges, the country's global medical footprint remains significant. Cuba's story shows that influence does not always come from weapons or wealth. In some cases, it can come from clinics, classrooms, and the ability to send help where others cannot.